Childhood drowning is the #1 cause of death for children under the age of 4. Now, a new school in Illinois is opening its doors to teach kids how to survive in the water if they accidentally fall in. Christian Farr has a look at the program.
It might be tough to watch. Children being tossed into a swimming pool. But this is the major part of a swimming program that can teach very young children to save their own lives.
I've heard terrible stories about children drowning.
Last year, Leah Ramos enrolled her daughter Sophie in the Baby Otter Swim School, a Florida-based company that has now branched out into the Chicago area. The school takes a unique approach by drown-proofing children.
I turn my back and she falls in the water. She knows exactly what to do.
And knew that I needed to get into this as a passion to make sure that what happened to me never happens to another parent.
Company president Mindy York has been preaching the benefits of this program since the day when her own child almost drowned. In just 5 30-minute sessions, York's instructors teach children how to first turn if they fall into a pool. They then learn to kick towards the edge, and finally they are taught to reach in order to pull themselves to safety.
There's swimming lessons and there's water survival. We do both, but the first thing that we do is water survival because they need to learn to know what to do.
And this is what this program is all about. Making sure that these children can save their own lives.
You see kids take swim lessons all the time, but they don't learn how to not drown.
Connie Payton, the widow of Bears running back Walter Payton, enrolled her own grandchildren into the program. Payton has now become a spokesperson and wants all children to learn this life-saving method.
They might not be able to swim completely the whole length, but if they fall in, they know exactly how to save themselves.
Experts say participating in formal swimming lessons can reduce the risk of drowning among kids between the ages of 1 and 4. A quarter of cancer survivors are dealing with financial hardships, according to a new report. The report shows survivors are spending an average of $1,000 on out-of-pocket medical costs every year, compared to $622 for non-cancer patients. Cancer survivors are also more likely to borrow money, go into debt, and file for bankruptcy. They're also dealing with psychological hardships, with 34% saying they worry about large medical bills.